your response is called the normal distribution, or the bell-shaped curve. And at one end of that curve, you're going to have a small percentage of the population which is very resistant to that toxicity of that substance. And the other end of the bell-shaped curve is going to be people very sensitive to it. And those are the people, the 1%, 2%, 3%, who respond even to 1 part per million drinking water. In fact, they did an experiment, 14-year experiment, where they gave people 1 milligram of fluoride in a tablet form or a placebo. And they identified all these symptoms, which were the symptoms disappeared when they stopped taking the tablet, and they reappeared when they started taking the tablet again. So that is all documented, and we're getting the same symptoms now from people drinking fluoridated water. In addition to that, which I think muddies the water somewhat, is what Bill was talking about. I think there are people that have multiple chemical sensitivity, which is usually triggered by an event, like exposure to a nasty pesticide, and after this one-time exposure, they then become sensitized to a whole range of different chemicals, and one of those chemicals is fluoride.
Now, how do we also know that, for example, fibromyalgia isn't caused from this? Because they don't know what causes that.
That's right. There's an overlap. There's an overlap with the symptoms of that disease and the symptoms I've talked about, chronic fatigue syndrome and so on. It's very upsetting because doctors in the West are not trained to recognize this system. We don't have labs that on a routine basis test the blood levels or the urine levels, which is the simplest one, to see if someone who's reporting these symptoms is being overexposed to fluoride. The doctors are not trained to recognize this. In August, both Bill and I heard a brilliant presentation from Dr. Sushila from India. And she has spent over 30 years studying the effects of fluoride in the villages in India. And she has backed up these, if you like, anecdotal reports with very scientific studies. She's got electron micrographs of the gastrointestinal tract. You can see the tract. And you can see the difference with someone drinking no fluoride in their water, 1.2 parts per million in their water, and 3 parts per million in the water. You see the microvilli, which are the little hairy things on the lining, which absorbs all the nutrients, disappearing. You see the cells, the goblet cells, which are supposed to be producing mucus, are disappearing. You see these cells going from the hairy-like things, which you expect, to practically bald, just going from no parts per million to 3 parts per million. And once when she was giving this presentation, actually an American scientist said, are you getting anemia in the endemic areas? And she said, why? He said, well, what you're looking at there, if you're getting rid of the microvilli, you're not going to be, those people are not going to be absorbing the nutrients. They're not going to be absorbing the iron, and that would lead to anemia. And so she said, wow, I'm going to look. And sure enough, she found there was a lot of anemia in these endemic fluoride areas. But better, the good news is that she treated it in a very simple fashion. She, first of all, tested to see if there was high levels of fluoride in the urine and blood. If it was yes, then she said, right, identify the source, remove the fluoride, put them on a good nutrient diet. And then she found that the hemoglobin levels in the pregnant women went up, and their birth weights went up, and the fluoride levels, of course, went down. And she's done that in hundreds of cases. So something as serious as anemia in pregnant women and low birth weight babies with lifelong ramifications can be cured in India simply by removing the source of fluoride and putting the people on a good diet for fruit and vegetables. And, of course, the whole thing is tracked scientifically. But doctors in the West do not know this. This is a time of economic crisis. If we were to stop fluoridation tomorrow, we would save millions of dollars in chemicals, equipment, testing, and, of course, promotion of fluoridation. Millions of dollars would be saved in cities, in towns, and in the federal government if we stop fluoridation. But we would also see, George, I believe, millions of dollars saved of people not having to get those medicines for gastrointestinal problems, headaches, pain in the joints, and so on. And I'll give Bill a chance to talk because I'm talking too much. I want to come back and talk to you about the fact that patients in Europe in the 30s, 40s, and 50s were given fluoride tablets to lower thyroid function. And these were hyperthyroid patients. And I'll come back and talk about hyperthyroidism in this country and a possible relationship between that and fluoridation.
All right. And, Bill, are you seeing more dentists jumping on this bandwagon, the opposition of fluoride?
Yes, I am. It's a slow process because we have been so ingrained that it's safe and effective, but they are slowly getting on and saying, we're opposed to fluoridation, we're opposed to too much fluoride, but they are very scared to speak out much. You know, a real key here that Paul brought up that I think is very important as a dentist, I need to speak on it, and that is who diagnoses what in medicine, dentistry. The California Board of Dentistry, when asked whether dentists, it is in the purview of dentistry to diagnose the medical safety of fluoridation, the California Board of Dentistry said no. Now, this is a no-brainer. Dentists do not diagnose IQ problems. You don't go to your dentist to diagnose thyroid problems. You don't go to your dentist to diagnose bone problems or all these other medical diseases and problems that are happening. You don't go to your dentist. Now, we've had a lot of anatomy training, but that's not who you go to for treatment and diagnosis. Yet when the word fluoridation comes up or fluoride comes up, all the health care seems to say, get the dentist together and let them make this decision. So the CDC and other people who are talking about fluoride, and of course the CDC now says that they do not determine the safety of fluoridation anymore, but any groups of people evaluating fluoridation, they are generally groups of dentists. When you're talking about the addition of fluoride to water or the safety of fluoride to water, they're usually groups of dentists that get together and determine this. And yet we aren't licensed to do it. So we can't diagnose the safety of medical safety of fluoridation. And that's one of the problems where we've had a real lack of oversight. The physicians, toxicologists, chemists, other people need to be looking at this thing and not just relying on dentists, because the dentists are saying it's safe and because it's relatively safe for the teeth.
I've always thought if you follow the money trail or figure out who benefits, you get answers. Who's benefiting from fluoride in the water?
Well, there's several groups of people that are obviously dentists think it's actually reducing the amount of decay, and so it's kind of a charitable thing for dentists. But as long as people think that fluoride is good, well, then we do fluoride treatments. The toothpaste companies, they sponsor research, and Procter & Gamble is a big one that loves to encourage the use of fluoride in topical use, and of course, then there's the chemical companies. But those are the main ones that I think are benefiting.
Well, let me throw in a few. First of all, fluoridation is the gravy train for dental research. Millions upon millions of dollars are being spent researching dental fluorosis, dental decay in the context of fluoride. The whole National Institute of Dental Research was built on the backs of the fluoridation program in 1948.
So there's money changing hands there. Paul, again, we get you at a break. We'll be back with you. We'll talk about this in just a second. Next hour, we'll open up the phone lines with our special report on fluoride in our drinking water, and we'll be back with our two guests in just a moment on Coast to Coast AM. Okay, Paul Conant, who benefits?
Well, the sugar industry. The sugar industry in 1949, 1 year before the U.S. Public Health Service endorsed fluoridation, said we need to find a way to reduce tooth decay without reducing sugar consumption. I think they've always been a silent player in this whole business. All the sugar interests, from cornflakes to candy to soft drinks, I think they see fluoride as their salvation. You've got the phosphate fertilizer industry. We've already mentioned that.